Cold open, we tested 29 melatonin brands sold at your local pharmacy, and 3 of them tested positive for MDMA. The same controlled substance that lands people in federal prison is sitting in bottles marketed for children's sleep. Locked intro, welcome back to the Real Bio Protocol, the channel where we break down the science of peptides, fitness, and health optimization that most people will never hear about. Today, we are diving into something that could completely change the way you think about the sleep supplement sitting in your medicine cabinet right now. We are going to cover exactly how contamination happens, what the real science says about melatonin quality, the results of actual lab testing, and exactly what you need to do to protect yourself and your family. Stay with us until the end because we are going to tell you which brands actually pass testing and which ones you need to throw away today. Let's get into it. ACT1, the problem, melatonin is everywhere. It is the #1 supplement parents give their children. Over 27 million Americans use it regularly. You can buy it at gas stations, grocery stores, and online without a prescription. Most people assume if it is on the shelf at a major retailer, it must be safe and it must be regulated. Here's the truth they do not want you knowing. The FDA does not test supplements before they hit shelves. There is no pre-market approval, no mandatory quality testing, no contamination screening. Supplement companies essentially operate on the honor system. They pinky promise their products contain what the label says, and the data shows that promise means absolutely nothing. A landmark study published in the Journal of Clinical Sleep Medicine tested 31 melatonin products. What they found was disturbing. The actual melatonin content ranged from 83% less than labeled to 478% more than labeled. Some products contained almost 5 times the dose on the bottle. Parents giving their kids what they think is 1 milligram could actually be dosing them with 5 milligrams. But it gets worse. Much worse. ACT2, the hidden truth in that same peer-reviewed study, researchers found serotonin, an unlabeled neurotransmitter, in 26% of the products tested. Serotonin is not supposed to be there. It is not listed on the label, and it can interact dangerously with antidepressants and other medications. The FDA has known about melatonin contamination issues since at least 2017. They have issued warning letters. They have documented problems, and yet contaminated products remain on shelves year after year. When independent labs began testing more aggressively, the findings became even more alarming. Multiple analyses have detected controlled substances, including MDMA precursors and synthetic compounds that have no business being anywhere near a sleep supplement. How does this happen? Shared manufacturing equipment, cross-contamination from other product lines, inadequate cleaning protocols. Some facilities that produce supplements also produce other compounds, and trace amounts can carry over between batches. The supplement industry generates over $50 billion annually in the United States alone. Proper testing and quality control cuts into profit margins, and without mandatory enforcement, many companies simply skip those steps. ACT3, the mechanism understanding why this matters requires understanding how melatonin actually works in your body. Melatonin is a hormone produced naturally by your pineal gland. It regulates your circadian rhythm, your internal sleep-wake cycle. When darkness falls, your brain releases melatonin, signaling to your body that it is time to sleep. Supplemental melatonin works by artificially elevating these levels. The problem is dosing matters enormously. Research suggests effective doses are often between 0.5 and 3 milligrams. Most commercial products contain 5 to 10 milligrams, already far more than necessary. Now add contamination variables. If a product contains undisclosed serotonin, it can affect neurotransmitter balance. If it contains stimulant compounds, it directly counteracts the sleep-promoting effects. If it contains MDMA or similar substances, you are unknowingly ingesting controlled drugs that affect serotonin receptors, dopamine release, and body temperature regulation. For children whose developing brains are more sensitive to chemical disruption, these contamination risks are amplified significantly. ACT4, the solution here is exactly what you need to do. First, only buy melatonin that carries third-party certification from NSF International, USP, or Consumer Lab. These organizations independently verify that products contain what labels claim and screen for contaminants. Look for their seals on the packaging. Second, choose pharmaceutical-grade melatonin when possible. Brands that test every batch and publish certificates of analysis demonstrate actual accountability. Third, start with the lowest effective dose. Research supports 0.5 to 1 milligram for most adults. More is not better with melatonin. Fourth, consider the source. European melatonin products face stricter regulations than American supplements and often demonstrate higher purity in testing. ACT5, the bigger picture, this is not about fear. This is about information. The supplement industry can work. Quality melatonin can genuinely improve sleep without side effects, but you need to be an informed consumer because no government agency is protecting you. By the end of this video, you now understand exactly why contamination happens and exactly how to avoid it. You know which certifications actually matter. You know the right dosing. You have real knowledge that most people never access. Sleep is foundational to everything: recovery, hormones, cognitive function, longevity. Getting this right matters. Locked out row, the science is out there and now you have it. That is why we are here. This is the Real Bio Protocol. If you enjoyed this upload, do not forget to like and subscribe. Subscribing is completely free. Share this with someone who needs it and tune in again for the next upload. See you then. If you enjoyed this upload, do not forget to like and subscribe. Subscribing is completely free. Share this with someone who needs to hear it. Tune in again for the next upload. This has been the Real Bio Protocol. Sources: Erland and Buppender, Journal of Clinical Sleep Medicine, 2017. Found melatonin content varied from -83% to +478% of labeled amounts across 31 supplements. Greg Damberger and Iannikieva, Journal of Clinical Sleep Medicine, 2017. Detected serotonin contamination in 26% of tested melatonin products. Cohen et al. JAMA, 2023. Documented continued widespread inaccuracy in melatonin supplement labeling and dosing.